Many LEAP sites have expanded the role of the MA as part of their team-based care model. In this video, we learn about one LEAP site's approach and also briefly introduce several other examples of MA role expansion. Clinic staff experimented and improved upon the role for over a year and a half at one clinic, Sebastopol Community Health Center, before rolling it out to other sites. Care Team MAs at West County work with a dedicated provider and are expected to manage the daily clinical flow efficiently, run team huddles, and perform population management for their patient panel, including calling patients who need to come in for overdue services or to make sure they have filled medication prescriptions.
We began the process of just impaneling all patients, but we piloted it with one care team, which I happened to participate on. And so we just started measuring it. So was it working? Were the relationships building? Were patients coming back? Were the numbers getting better? And we were able to kind of do some quality measures around that, and the outcome was really great. It's something that develops over time. It's, nobody walks in as a medical assistant and thinks that they are going to be able to lead their team and make a difference in their patient's life in that way. So it's definitely something from the orientation, like during the orientation process, that we lay out as an expectation, and we say, you're going to be the leader of your team, you're going to manage the flow of the day, you're going to be able to proactively order labs and diagnostics for patients when they're not even here. So we kind of lay it out there as an expectation from the beginning. And I think at first that those are just words, so we have to spread that culture amongst the agency.
One tool that West County developed to support MAs owning their role in providing quality care to patients is the MA report card. The medical assistant report card is a way to enable us to track the work that our medical assistants do during their population management time. Population management time is when our medical assistants are able to manage our chronic disease population. It's outside of the office. So what we do monthly is we have a quality assurance dashboard that measures those outcomes, and we print them out by care team specific, and then we're able to show that medical assistant how well they're doing. So for example, if we're tracking our diabetic patients and we're trying to figure out how many of their diabetic patients got their hemoglobin A1C done within the last 6 months, we can actually see that in a month, 86% of that panel was able to get that hemoglobin A1C done in the last 6 months. And we would be able to show that to the medical assistant and say, this is because of your work during that dedicated 4 hours of time managing those patients while they're outside of the office. Visit the MA topic at improvingprimarycare.org for MA job descriptions, training curricula, and examples of career ladders and compensation for expanded roles.